Today, it's become something of a tradition for Taiwan to seek participation in the World Health Organization's annual forum as an observer, only to be rejected due to pressure from China. However, Taiwan's role with the WHO was once very different.
After the end of World War II, officials from the Republic of China were instrumental in establishing the World Health Organization. Taiwanese doctors freely shared their invaluable experience with other member countries. The relationship between Taiwan and the WHO was one characterized by mutual assistance and growth. It's a relationship that came to an end one fateful day in 1972. We now give you part one of our three-part Sunday special report.
In 1945, World War II came to an end. To safeguard this fragile peace, the world came together to establish the United Nations. The R.O.C. was one of the UN's founding members. In the aftermath of the war, the living conditions were dire in many countries. In response, the governments of the R.O.C. and Brazil proposed the establishment of an organization to improve public health.
那某个午餐的这个会议中那个时候挪威有一个 Dr. Carl Evang.
There was a luncheon one day attended by Norwegian Dr. Carl Evang, a Brazilian scholar surnamed De Paula, and a Chinese scholar named Shi Siming. The three of them were eating together when the Norwegian scholar said, "Why don't we establish a new health organization?" As soon as he brought it up, both the Chinese and the Brazilian representatives thought it was a good idea and said, "We will simply bring it up at the UN General Assembly."
In 1948, the WHO was formally established. Its headquarters was established in Geneva, Switzerland. As the world's largest public health organization, its goal was for all of mankind to achieve the highest standard of health possible.
那时候我们作为这个所谓的倡议国。
Back then, we were one of the countries that proposed the WHO and one of its founding nations. It happened back in 1948. The UN approved the proposal on April 7th. Back then, the 61 member countries of the UN, including the government representing China at the time, became the founders of the WHO when they all signed an agreement to establish it.
Because the R.O.C. was a founding member of the UN, it naturally became a member of the WHO. It was classified under the organization's Western Pacific Division. Then Deputy Health Minister Fang Yiji became the division's first head and was stationed at the division's office in Manila.
我们的人在1952到1966。
Our official was there from 1952 to 1966. Those 15 years, he was Secretary General. Maybe you could say he was a regional Secretary General or a Director General. He was among those who held that position the longest.
The WHO's executive board comprises individuals from 34 member nations who together represented an independent group of specialists. In May every year, Geneva hosts a meeting of the WHO General Assembly, which has the highest policy-making authority in the organization. The WHO's Director General is the key figure and holds the office for 5 years per term, up to a maximum of 2 consecutive terms.
卫生组织是一个行政机构，就是里面都是专家。
The WHO is an executive organization made up of professionals. All of them have titles such as Director General or Secretary General. The WHO General Assembly meetings are akin to Board of Directors meetings. It's an assembly of directors. It's 190-odd countries, and if you want to join the WHO, you need this Board of Directors to agree.
Former WHO Western Pacific Director General Fang Yiji, seeing the dire strait of public sanitation in Taiwan at the time, had pushed for the Western Pacific Division to support Taiwan and invest in public sanitation facilities in the country. In 1952, the WHO Western Pacific Regional Nursing Education Conference was held in Taiwan.
民国41年11月3日，世界卫生组织西太平洋区护理教育会议在省警务处大礼堂举行。
比如说，当时 WHO 有来帮我们的，大概有3大块。
The WHO came over here to help us. There were basically 3 major sanitation projects. The first was a campaign to prevent communicable diseases. The second focused on natal and maternal health, and the third was on environmental sanitation.
The WHO implemented important sanitation projects in Taiwan, a place where there was still much left to do. The presence of the WHO brought new vigor to the government from top to bottom. Its projects became an important foundation of growth for Taiwan's economy, which later took off.
WHO 啊，1952年先签了一个4年的扑灭疟疾及蚊虫的控制计划。
In 1952, the WHO signed off on a 4-year plan to tackle malaria and mosquitoes. Then sometime around 1958, there was another 4-year plan to fully eradicate malaria.
Other communicable diseases in Taiwan, including trachoma, diphtheria, and tuberculosis, caught the attention of the WHO, which sent experts to the island to assist with prevention measures, such as vaccinations.
那个时候，沙眼防治老师就是去受训。
To fight trachoma, teachers got training. They would open your eyelids and tell you if you had trachoma. Whether it was funded by the US or the UN, I can't remember exactly. But in a project managed by the US, everyone was given a small container of chlortetracycline that had their name written on it.
Another project targeted parasites. During Taiwan's agrarian period, the traditional method of using manure as fertilizer led to serious problems with parasites. Many malnourished children at the time carried parasites in their stomachs.
每学期都要去吃那个驱虫药、蛔虫药。
Every academic term, they would take anti-parasitic drugs and roundworm medication. Nobody had toilets that flushed, so the day after they took the medication, you'd see clumps of white worms on the side of the road because people would relieve themselves there.
Back then, basic supplies were hard to come by, and much of the population was poor. There was a high mortality rate for mothers giving birth and for their infants. Taiwan relied on the WHO for nutritional support.
我们曾经设计的牛奶站啊，曾经有家庭计划。
We set up milk stations and offered family planning services. That all had to do with the WHO, especially the milk stations, which were provided by UNICEF. They supported us with lots of fat-free milk.
联合国世界卫生组织西太平洋区第10届区域会议。
Taiwan made swift progress tackling trachoma, tuberculosis, and malnutrition amongst mothers and children. Its progress was faster than that of all countries in Southeast Asia.
西太平洋区属会议或者说区域会议，第10届、第18届都在台湾举行。
The Western Pacific meetings, as well as the 10th and 18th all-area meetings, were all held in Taiwan. I looked at the historical data on the period in between and discovered that there were at least 6 technical meetings also held in Taiwan. This demonstrates that back then, we put a lot of hard work into our participation in the WHO and played a very important role.
To combat malaria, Taiwan used DDT, spraying it along every street and alleyway. They took blood samples to find carriers. After 13 years, the efforts paid off. In 1965, Taiwan received from the WHO a certificate recognizing its eradication of malaria. The Deputy Director General of the WHO flew to Taiwan to confer the certificate.
我们可能是全世界第一个拿到这个证书的国家。
We may have been the first country in the world to receive the certificate. This is quite extraordinary. In those days, our success story was touted as a model by the WHO. Our malaria specialists went all over the place helping the WHO give guidance to other countries. These specialists include Dr. Mosquito, or Lian Zhiqing. He was truly a specialist in fighting malaria.
In 1967, the WHO launched an annual scholarship to encourage outstanding Taiwanese to study abroad. Over the course of 5 years, 120 people benefited from the program.
WHO 那时候对我们非常重要。
In those days, the WHO was very important to us. Besides helping us with various projects, they helped send many Taiwanese overseas to study because our medical community needed leaders. For example, there was my professor Chen Gongbei and former pediatrics research director Fan Guangyu. Many people were sent to the US for training and then came back to be leaders.
亚洲广告会议和世界卫生组织
In September 1967, the WHO's 18th General Assembly meeting was held at Taipei's Shijian Hall. This was the last time the WHO held a meeting in Taiwan. In November 1968, the election of Richard Nixon to the U.S. presidency forever changed the course of U.S.-China relations.
那个时候的氛围呢，大概就是
It was a charged political atmosphere. Starting in the 1960s, China, that is the People's Republic of China, started going around promoting the One China principle. It was all over the place saying that there was only one of each country. Are there 2 Frances? Are there 2 USAs? So there should also only be one China.
Nixon sent his national security advisor, Henry Kissinger, on secret diplomatic missions to engage with China. In April 1971, Kissinger paid a visit to Beijing. For Taiwan, the turning tide had devastating implications. The following month, the 24th WHO General Assembly meeting took place in Geneva. At the time, Taiwan's representatives at the meeting included the nation's former ambassador to the UN, Zheng Baonan, former health minister Yan Chunhui, and former deputy health ministers Zhang Zhikang and Xiong Wan. This would be the last time Taiwan would join a meeting at the WHO as a member country.
The delegation of the Republic of China has now decided not to take part to any further proceedings of this General Assembly.
On October 25, 1971, the UN passed Resolution 2758 in a vote. With that, the UN recognized the PRC as the only lawful representative of China.
Adopted.
After the R.O.C. was expelled from the UN, Taiwan's international position shifted almost instantly. Its allies cut ties in rapid succession, and Taiwan lost its seat in global organizations, one after another. In 1972, Taiwan was ejected from the WHO, its seat as founding member taken by the PRC.